welcome to Eduvis Academy. We provide online and offline classes for nurses who are preparing for licensing exams to the Gulf countries like DHA, DOH, MOH, Prometrics, and so on. We provide online and offline classes. Basically, it's an application program which includes video theory classes, study materials, mock test, exam practice test, video discussions, and so many other facilities. To know more about our classes, please contact us directly. So you can contact through WhatsApp and direct call also. So before wasting any time, let's go to today's discussion topic, which is thalassemia. Okay. So thalassemia is an important topic which has been asking recently for all the exams. So basically, it's an inherited disorder which causes or which affects the blood cells as well as hemoglobin. So it causes decreased production of hemoglobin as well as decreased RBC. So let's see about more details about thalassemia. Okay, so it's an inherited disorder that affects your body's ability to produce hemoglobin and healthy red blood cells. So there are two types of thalassemia, alpha and beta, depending on the chain which has been affected. Okay, it affects on the globin chain in the hemoglobin. So there are two types of chains in globin, which is alpha and beta. Depending on that, it's classified into two: alpha thalassemia and beta thalassemia. It's a genetic blood disorder causing decreased or absent globin chain production, leading to microcytic hypochromic anemia. Microcytic means decreased cell size. Hypochromic means decreased pigmentation of RBC. That is microcytic hypochromic anemia. So just like we said, there are two types: alpha thalassemia, which affects alpha chain, alpha globin, and beta thalassemia, which affects beta globin. So what happens is it reduces the ability of the body to produce enough hemoglobin, and it affects the bone marrow, resulting in decreased production of RBCs. Okay, so this is the introduction of thalassemia. Now let's see the clinical features. Okay, before that, some important points: severe alpha thalassemia. Okay, severe or complication of alpha thalassemia is called hydrops fetalis. It causes hydrops fetalis. Hydrops means water. Excessive accumulation of water in the fetus is known as hydrops fetalis, which is really fatal. Many cases causes death of the fetus. So it's a really dangerous condition. So that is a complication of alpha thalassemia, hydrops fetalis. And beta thalassemia, complication of beta thalassemia, it's known as beta thalassemia major or Cooley's anemia. Okay, so this is most important topic, thalassemia major. The clinical features and interventions are really important. So basically, clinical features are one, it is anemia. So pallor and fatigue will be there. And characteristic features in thalassemia major are one is frontal bossing. Frontal bone will be prominent. It is known as frontal bossing. And second is chipmunk faces. Chipmunk faces. Okay, so chipmunk is an animal. So the face appearance will be it will resemble the face of the chipmunk. That's why it is called chipmunk faces. So this is called as frontal bossing, and this is known as chipmunk faces. Okay, so these are the two characteristic features of thalassemia major, and another it's can be called as a complication, and one of the important features is splenomegaly. So severe enlargement of spleen, because more RBCs are distracted, it results in splenomegaly, which might lead to rupture. So splenomegaly might require surgery in cases. So infection might be at risk. So that's why splenomegaly is more important. And another is growth retardation. Okay, and due to RBC destruction, the baby might require repeated transfusion, and because of this repeated transfusion, iron overload is another feature that depends on the transfusion. So one of the important intervention is to monitor iron levels. Okay, so repeated transfusion might lead to iron overload, also called as hemosiderosis. Hemosiderosis is the pigmentation of the skin due to iron overload. Bronze pigmentation or dark colored pigmentation will be there because of iron overload. This is known as hemosiderosis. So these are the features of thalassemia major. Severe anemia leads to pallor and fatigue, and characteristic features are chipmunk facies and frontal bossing. Another one is splenomegaly, and because of repeated transfusion, it leads to hemosiderosis, iron overload, and hemosiderosis. Okay. So diagnostic test, this is also important. Diagnostic test, of course, we will do the blood test. CBC we will do. In CBC, in the starting we discussed it leads to decreased hemoglobin. So mean corpuscular hemoglobin (MCH) will be decreased. Also mean corpuscular volume (MCV) both will be decreased. So that's why it's called as microcytic hypochromic anemia. Okay. And another diagnostic test is iron studies, just like we discussed. Iron monitoring iron levels is really important. Iron overload is possibility. Sometimes it will be normal, and mostly it will be abnormal. So iron testing is another diagnostic test. And reticulocyte count, that is measure of young RBC, whether it is healthy or not. To detect the young RBC, we do reticulocyte count. And most confirmatory diagnostic test in thalassemia, especially in beta thalassemia, is electrophoresis. Okay, hemoglobin electrophoresis test. This is important. Okay, for alpha thalassemia, genetic testing is done, but since mostly question is coming from beta thalassemia, diagnostic test is electrophoresis test or hemoglobin electrophoresis test. Okay. Next, management of beta thalassemia major. Okay, what are the management or interventions of thalassemia major? Mainly, we will see about the management. Okay, so we have discussed it already. Due to repeated RBC destruction, we need to have, or the child will need to have blood transfusion repeatedly. So first one is blood transfusion, and because of blood transfusion, we said iron overload is a possibility. So iron chelating agents had to be given. Deferoxamine or deferracerox drugs will be given, and folic acid supplements is another management for formation of healthy blood cells. And if the bone marrow is severely depressed, bone marrow transplant or stem cell transplant is required. Okay, for minor thalassemia, beta thalassemia minor, no treatment is required. So let's see about the management mainly. First is blood transfusion. Second, iron chelation, antidote of iron is given, deferoxamine or deferracerox. Folic acids for healthy blood cells, bone marrow and stem cell transplantation. For thalassemia minor, no treatment is needed. Avoid unless deficient is confirmed. Okay, so if only deficiency we have to give iron, otherwise no management is required for thalassemia minor. So these are the management of beta thalassemia major and minor. Now let's see the interventions. Okay, so we already said what are the management of thalassemia major. So interventions will be according to that. So first, blood transfusion is given. So we have to monitor the patient. We have to follow the interventions of blood transfusion, monitor vital signs, and the principles of blood transfusion also. Okay, so double check it before giving. All these principles needs to be taken care of. So first is administer RBC as prescribed, and second, iron monitoring is also important. Serum ferritin levels should be monitored. If there is iron load, we have to give antidotes. These are the basic interventions. And then because baby will be having decreased oxygen, decreased RBC, the child will have tissue hypoxia. So we need to supply O2, and the diet is also important. High calorie, high protein diet should be given along with folic acid supplements, because folic acid supplements we discussed already, it's for the healthy RBC formation, and because patient is having hypoxia and breathing difficulty, the child might get fatigue easily. So that's why high calorie, high protein diet. Okay, so first interventions are administered packed RBC transfusion as ordered, iron chelating agents, monitor serum ferritin levels, high calorie, high protein diet with folic acid supplements. Assess for signs of hypoxia. Those are tachycardia, dyspnea, and pallor. If there are signs of hypoxia, O2 is given. So this is also important. So that's why I marked it here. And next interventions are, okay, make sure vaccines are up to date, especially pneumococcal and meningococcal. And one more is there influenza. Because of this splenomegaly and RBC destruction, patient is prone for infection, just like I discussed earlier. So even if surgery is required, we have to make sure that proper vaccinations are given to the patient, especially pneumococcal, meningococcal, and influenza vaccine. Encourage school attendance and normal activity as tolerated. Okay, child is having might be having weakness and hypoxia, but we should encourage, depending on the age, we should encourage school activity, school attendance, and normal activity as tolerated. Okay, it is for the emotional development and emotional support of the child. And next is important education for the parents and patient, especially for parents. Education is importance of regular transfusion. The main focus is that we know what are the managements, so we have to educate them what are the benefits of this management, and we have to encourage them. Okay, so importance of regular transfusions. Okay, avoidance of iron rich supplements. Okay, this is important because chances are that already child is having chances of iron overload. So if you give iron rich supplements, it will lead to complications such as hemosiderosis. And adherence to chelation therapy. Okay, these two are major important points to teach their parents. Avoid iron rich supplements and adherence to iron chelation therapy. Okay, then you have to look for signs of complications. If hospital, we can monitor the child. So while going home, we need to teach parents about this. So fever, dark urine, abdominal swelling, and shortness of breath. These are the signs of infection. So you have to teach the parents about this. So these are the key points of beta thalassemia major. Okay, so I have highlighted the important points in bold letters here, and we have discussed what are the symptoms, management, and interventions of thalassemia major. So let's see some questions related to this thalassemia. Okay, first is a child with beta thalassemia major receives frequent blood transfusions. What is the priority nursing intervention? A. Encourage high iron foods. B. Monitor for signs of iron overload. C. Administer iron supplements. And D. Limit fluid intake. So, I think you have the answer already. We have discussed it more than one time. So, frequent blood transfusions. Because of that, we said the child is at risk for iron overload. Okay. So, answer is option B. Monitor for signs of iron overload. Okay. Next one, child with beta thalassemia major has been receiving frequent transfusion for years. Mother reports darkening of the skin, fatigue, and abdominal swelling. What complication does the nurse suspect? Acute kidney injury, iron overload, dehydration, and vitamin deficiency. So here also child is receiving frequent transfusions. So first thing that should come to your mind is iron overload. Okay, darkening of the skin. It's clearly mentioned darkening of the skin. I have told you hemosiderosis means pigmentation of the skin. Fatigue and abdominal swelling. So what complication should the nurse suspect? Okay, this is also iron overload. So answer is iron overload. Most importantly, this is known as hemosiderosis. Okay, so bronze skin, hepatosplenomegaly, and fatigue. So that's why abdominal swelling is there, because of hepatosplenomegaly and fatigue. So these all indicate symptoms of hemosiderosis due to iron overload. Okay. Next question. A child with beta thalassemia is scheduled for splenectomy. The nurse reviews that reviews the chart and sees vaccines due. Which action is priority before surgery? Okay, so child is scheduled for splenectomy. And options are give iron supplements, administer pneumococcal and meningococcal vaccines, start NPO 12 hours before, D prepare teaching about wound care. So this also we discussed earlier. Child is being prepared for splenectomy. So one of the complication that might happen is infection. Child is at high risk for infection. So priority is to make sure that we give the vaccines at time. Okay. So splenectomy equals high risk for sepsis. Vaccines must be given before surgery, especially pneumococcal, meningococcal, and influenza. So these vaccines should be given to prevent infection. Okay. So these are some of the sample questions related to beta thalassemia major. Hope you understood the topic. If you like this video, please like it and share it. And as I said in the beginning, if you want to know more about our classes, please contact us. Thank you.